Hi, I'm Dr. Mike Yates. I see a lot of women that come in to see me for breast augmentation. They'd like to improve the appearance of their breast. And breast augmentation is now the most commonly performed plastic surgery procedure in the United States. So when women come in to see me for breast augmentation, we want to evaluate them and help them achieve their goals. Most ladies have an idea of what cup size they want to be. Perhaps they have modest goals. They want to be a nice B cup. Maybe they want to be a little more bold and be a D or a double D. So we kind of factor that into our decision-making process. Of course, we want to examine their breast and see what is the nature of their breast, how much breast tissue they have. Do they have much sagging of their breast? Because if they have a lot of settling or sagging of their breast, then we might also need to consider a mastopexy, which is a breast lift type procedure. But assuming that a breast augmentation alone will give them a good result, then we need to think about the volume of the implant. So again, patients think about breast cup size, but we in turn need to translate that into cc's or milliliters, the volume of the breast implants. So how do patients determine that? Well, one way we've done it for a long time is to have them try on breast implants. They actually set slip sizers on their breast underneath the bra that is their goal, and that helps them decide an implant size. It's actually fairly accurate. But we really love our new Vectra imaging system, and this shows an example of how that is done. It's a computer that takes a photograph of the torso area, so it's a three-dimensional presentation of the chest area, and we can in turn dial in different breast sizes, so we can show larger sizes, smaller sizes, different implant styles, and this is a great way for the patients to sort of anticipate what their final post-operative results can be like. So having decided what implant volume we would like, or the range at least, then we turn to what type implant do we want. So we have saline breast implants. They've been around for a long, long time. Traditional silicone gel breast implants have been around for a number of years. And now just on the market are what are called form-stable or highly cohesive gel implants. And this is an Allergan implant just approved by the FDA. And it's going to be kind of neat because it has much more cohesive gel because it's going to hold its shape better. But I've done plenty of saline breast augmentations, and women love them. They get very nice results. Sometimes women are reassured by the fact that a saline implant, if it leaks, well, it's kind of a no-brainer. Suddenly you're flat, it's easy to recognize, it's easy to come back and fix. So they're reassured by the fact that the body absorbs that salt water harmlessly. Now, saline implants might be a little firmer in how they feel, and yet they can be a little palpable to some extent. So oftentimes off to the side of the breast, the patient might be able to feel some slight wrinkling. But it'd be very unlikely to see the fluid movement or have widespread wrinkling with a saline implant. Silicone implants, and this is a typical silicone gel implant that we've used traditionally for a number of years. They're softer, they feel more like breast tissue. They're round, you can see, and they have a smooth surface. So if a woman is looking for perhaps a softer consistency to her breast, then this is a good choice as well. Now you can see that it has a few little wrinkles in it, but oddly that doesn't really show up when it's underneath the breast and the muscle of the chest wall, and so it gives a nice look with a nice soft consistency. Now some women are a little maybe fearful of what if this leaks, what happens to the silicone? Well, the silicone tends to stay right where it is. It's sort of contained by the natural scar tissue around the breast, so we don't worry too much about it. If you discover this implant were leaking, say with a mammogram or an ultrasound, you still want to have it replaced. And both of the implants actually have warranties that help replace them. So smooth, round implants, sort of the traditional things we use. If you put them in the chest area, they can float around a little bit. It doesn't really matter too much. The newer implant is what's called a form-stable implant. Now, with these traditional silicone implants and with the saltwater implants, there's going to be a little fullness at the top of the breast. And so here's a patient of mine that had breast augmentation, and you can see that she's got a little fullness at the top of her chest area. That's what I call the augmented look, and that's really kind of a desirable look for many patients. You see it in fashion magazines, you see it on your friends and neighbors, and so a lot of women do like the fullness in the upper aspect of the breast that you get with the smooth, round implants, be they saline or silicone. So, form-stable implants. This is the newest Allergan product. It's also called highly cohesive gel. You can see that it kind of has a shape that's more anatomic. So it's thin at the top, it's kind of rounded and projecting at the bottom. And so this implant tends to hold its shape a little bit better in the body, as opposed to, say, a silicone implant, which is a little more amorphous, maybe a few more wrinkles, but again, gives a nice result in the body. But I think that this is going to have utility for women that are looking for a smoother surface at the top of their breast, maybe more natural appearance, but still maintaining good projection at the bottom of the breast with good volume at the point of projection of the nipple. Now, I also think this implant is going to have a great utility for our breast reconstruction patients. If you think about what we do with breast mastectomies, a woman has cancer, well, she has all of her breast tissue removed. So what's left is really skin, a little layer of fat, and muscle. And so we're doing reconstructions for those patients with not a whole lot of tissue to hide the implants. And so for those patients, these implants give pretty good results, but sometimes they are a bit wrinkly. And I think these form-stable implants are going to be really nice to help maintain a really pretty shape for the breast and have a nice consistency as well. So you can see we've got lots of choices for breast augmentation, saline, traditional silicone gel, form-stable, and for our breast reconstruction patients, really the same things as well. It's all designed to give our patients the best possible results and make sure that we can help them reach their goals and they can be happy. I'm Dr. Mike Yates. Thanks for viewing with me today, and I look forward to talking with you again. Thanks.